to get started, I thought I'd just go over what I'm going to talk about. So I'm going to go over some basics for pelvic floor and core, how function can change, and then looking at the pelvic floor and running specifically, and then looking at what's next. So what can you do if this is affecting you? So starting off, just so you know who I am, vegan runner, running coach, personal trainer, and as a personal trainer, I specialise in women's health, and that's how I'm a holistic core restore coach. So I specialise in pelvic floor and core, anything to do with that. So menopause, I'm a menopause coach, hysterectomy, prolapse, and pelvic floor issues themselves. And then I also specialise in working with people with long-term health conditions. So people who, yeah, need some help managing their long-term conditions while staying active. And let me just check something here. Pelvic floor and core basics. So what do I mean when we're talking about the pelvic floor? So the first thing I've got here is pelvic floor anatomy. I thought it'd be quite helpful to go over that so you have an idea of what it is and what it looks like, because obviously it's internal, we can't see it. And the first thing to say here is that this is female anatomy, and I'll be talking about kind of female anatomy in women throughout this presentation. That's what I specialise in. But I did want to say that men do have a pelvic floor as well. Some people kind of think that they don't, because a lot of the time when we're talking about pelvic floor, it's to do with women, but men have a pelvic floor, and the anatomy is slightly different, and the causes of any issues with the pelvic floor are slightly different as well. But I just thought I'd say that so you know, everyone's got a pelvic floor. So on the left side, we've got a really nice kind of simplified image. We've got the pelvic floor here. That's attached to the pubic bone here and attached to the coccyx. And as you can see, it's supporting the pelvic organs, so bladder, uterus, bowel, and then the pelvic outlets as well. The image on the right is a little bit more detailed, and you can see here that the pelvic floor muscles, or the pelvic floor, is not just one muscle. There's actually three muscles, so it's three muscles laid together, and that forms the pelvic floor. And in this image, you can see the red, which is the muscle, and then the white here, which is connective tissue. And I'll be mentioning this connective tissue later. And I've also got my pelvic model, so just to kind of give you a bit of a 3D idea, you've got your hip bones, your pubis, coccyx and sacrum, and then you can see the pelvic floor muscles. Hopefully the light's okay on that, and you can see that as well. So the functions of the pelvic floor are to support and stabilize the pelvic organ outlets, to prevent prolapse of those organs, to help control the opening and closing of the pelvic organ sphincters, to support and stabilize the lumbar spine. So as I said about the pelvic floor attaching to the coccyx and the sacrum, so that's got support there for the lumbar spine. So sometimes issues with pelvic floor can also cause lower back pain issues as well. And then it also assists in reproduction, so it has a role to play in childbirth and also in experiencing sexual pleasure. So it's got a role to play in orgasms for both male and female. Then talking about the core, when we talk about the core, when I talk about the core, when most people talk about the core, it's the whole of the core. So some people think, oh, it's just the six pack, it's just the abs, but it's everything. So it's all the muscles at the front, your rectus abdomini, your obliques, your transverse abdominis, and then also all the muscles around the back as well. So it's kind of the whole container. It's not just the front of the body. Looking at the pelvic floor and core together, you can see that there's like a good connection between the pelvic floor, the core, and the diaphragm as well. So this is a really nice illustration because it kind of shows you how everything's linked. You've got the pelvic floor muscles here, so attaching at the pubis, attaching at the coccyx. You've got all the muscles up the back. You've got the diaphragm that's attached to the rib cage, and then all the muscles down the front as well. And you can see in this illustration that the breath and the diaphragm is also part of that core structure, and how we breathe as we're inhaling and exhaling affects the pelvic floor as well. So sometimes looking at and how we're breathing can help with pelvic floor issues as well. And to illustrate that, I thought we'd do a little bit of a demonstration with something called a purposeful exhale. So what I'd like you to do is just come into a nice sort of tall seated position. And all I'm going to ask you to do is take a really big breath in and then exhale and exhale, exhale, exhale for at least a count of 8 until you've got no more breath in there. And I want you to think about what's happening around your core. Where can you feel things? So if you take a nice big breath in and then exhale, 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 exhale until you've got nothing left. And then I don't know if anybody wants to say where they might have felt that, or you can say in the chat, which hopefully I'll be able to see. Brian's just said, oh, you felt engaged the pelvic floor at the end of the breath. Yeah, brilliant. And hopefully, Michelle, you and JJ, you kind of had that as well. So around the pelvic floor, you kind of feel it engage. You might also feel around your back and the lower back as well. So that's great. That's just kind of a nice demonstration of how, yeah, how the breath and the core works together. Lovely. So coming back here. Now I've kind of looked at the pelvic floor and the core and what we mean by the pelvic floor and core, I thought I would talk about changes to pelvic floor function. So changes to pelvic floor function can be a lot of things. So it can be pregnancy. So thinking about how during pregnancy the muscles change. There's stretching that goes along through the sort of the connective tissue to give room for the uterus. There's also altered breath and altered posture as well. So that kind of affects the pelvic floor. Childbirth, thinking about any injuries from childbirth, any scarring from any incisions, whether that's a C-section incision, a perineal incision, there can be scarring which can then affect the pelvic floor. Menopause, so decline in estrogen affecting the connective tissue, and I will talk a little bit more about that later. Some hereditary conditions, so hypermobility, other health concerns such as persistent coughing, constipation, an injury to the pelvic area, fibroids and endometriosis. And of those things that I've mentioned so far, you can see that a lot of those are going to be affecting women more than men. So conditions such as hypermobility affects a lot more women than men, same with connective tissue disorders as well, and then fibroids and endometriosis. Then there's lifestyle choices, so smoking, because that often leads to persistent coughing. Alcohol can affect the bladder, can be a bladder irritant, and then that can affect the pelvic floor. Weight, so if you're a bit heavier, that can affect the pelvic floor. Occupation, if you're sedentary or you lift heavy stuff a lot and you don't kind of lift it well, that can put a lot of pressure on the core and pelvic floor. Poor posture, exercise choices. So I'd always say there's not sort of exercises that I would say, well, definitely don't do them, but there may be things that are a bit more appropriate that if you have changes to your pelvic floor, then you might want to make some adjustments to your exercises. And then stress as well. So stress can be a big factor in how the pelvic floor functions. One of the big things that you think about when you're thinking about changes to pelvic floor is urinary incontinence, so leaking. The most common forms are stress incontinence, so that's when urine leaks when you're at times when your bladder is under pressure, so coughing, jumping, running, sneezing, those kind of things. And then there's urge incontinence, which is when urine leaks as soon as you feel a sudden intense urge to pass urine or soon afterwards. So sometimes this is called key in the door syndrome. So you put your key in the door at home and you just get this sudden urge to go and you can't stop it. It's possible to have a mixture of both, and the things that you would do to try and improve those are slightly different. But yeah, it's possible to have a mixture of both. But there's also fecal incontinence. So this is when you're either passing wind or stools without meaning to. And this is something that isn't as common, but it is still happens. So if somebody comes to you and they're talking about leaking, they might be quite comfortable talking about urinary incontinence. They probably wouldn't be comfortable at all talking about fecal incontinence, and there's a lot of embarrassment around it. But it is, it is something that happens. When women come to me with pelvic floor issues, if they have fecal incontinence as one of the symptoms, I would always refer them to a women's health physio in the first instance, because it can be a signal of something else that's happening in the body, so not just to do with the pelvic floor. So out of the two, the fecal incontinence is one that is like, yeah, definitely go and see someone first, rule out other things, and then we can look at your pelvic floor. Great. Then I just wanted to talk about hypertonic pelvic floor. So lots of people think that if you're having issues with your pelvic floor, if you're leaking, then it's because your pelvic floor is too weak. But actually, a lot of the time, and I would say for the majority of women that I see, it's the case that it's a hypertonic pelvic floor. And this means that it's overactive and it's tense or it's too strong. And quite often, you know if it's a hypertonic pelvic floor because you've been doing Kegels and they just haven't worked, because your pelvic floor is sort of already on this stress. It's already kind of overloaded, and you're trying to make it stronger, and it just can't get stronger because it's already strong. So you need to relax it so then the pelvic floor can function normally. Now, this is where stress can really contribute, because if you think about where you hold stress, quite often it can be in your shoulders, so your posture is also there, but a lot of the time it's in your stomach. And that kind of feeling of that gnawing in the pit of your stomach when you're stressed, if you've got that constantly there, then that's going to affect the other muscles, and that's particularly going to affect the pelvic floor, and that's going to get the pelvic floor sort of to that two-toned aspect and then cause the problems. But it's also really common in women with a background in athletic sports. So if you're working with anybody who has been running for a lot and has been running quite intensely, but also if they've got any background in dancing, gymnastics, any sort of athletics, and they've got an issue with their pelvic floor, it's more than likely to be a hypertonic pelvic floor. And this is also, I should also say that some people think that you would only get an issue with your pelvic floor if you've been pregnant or have given birth. But actually, if you think about this and the role that stress plays, a lot of women are under stress. A lot of women who don't have children are under stress. So it's definitely something that can happen to any woman. Yeah. So moving on to another issue that can happen and affect the pelvic floor is a pelvic organ prolapse. So in the top corner here, we've got a really simplified image of normal pelvic organ anatomies. There can be different kinds of prolapses. So you can have a bladder prolapse, you can have a rectal prolapse, and you can have a uterine prolapse as well. So this is where the organs aren't supported, either the connective tissues have been damaged or they're getting weaker, and they can kind of not support and then cause a prolapse. It can also happen after hysterectomy as well. So this is anatomy after hysterectomy. This one here is where there's been a vaginal vault prolapse. So if you know of anybody who is going for a hysterectomy, one thing I would really, really encourage them to ask their surgeon or their health practitioner is what is being done to support my vagina after the hysterectomy. I would hope it's standard practice that the vagina is always supported, because if it's not supported during surgery, if that isn't put into place, then the risk of having a prolapse increases. So it's definitely, if you know of anybody going for a hysterectomy, that's one question that they should ask, so that that risk is reduced. Looking at symptoms of pelvic organ prolapse. So it's things like a new feeling of heaviness and dragging in the pelvis, a new feeling of lower back pain, difficulty or pain with sexual penetration, an inability to wear tampons where that wasn't a problem before, and inability to empty the bowels completely, and tissues protrusion from the vagina or anus. So if anybody comes to you and says to you, you know, I'm leaking, oh, and I've got this real bad lower back pain, or everything just feels really heavy when I'm running, or anything like that, then I would suggest that you see if they can be referred to check to make sure that they don't have a prolapse, because yeah, there's things you can do about there's things you can do about everything. So I will talk about this at the end, but that is something that I would say. Any of these symptoms, go and see, be referred, and go and talk to somebody. And I'd also say that if anybody has symptoms of leaking, especially the fecal leaking, plus a feeling of heaviness and dragging, plus numbness around the back, numbness around the sort of pelvic area, then that is, I would say, please refer them, say them they should go to a GP. That is a sign of something called cauda equina, which can lead to paralysis. So if it's dealt with early, it's a nerve damage thing, and if it's dealt with early, then that shouldn't be a problem. But if it's left, it can lead to paralysis. So if you hear of anybody saying, oh, I'm leaking and I've got all this numbness, this yeah, please ask them to refer. Okay, and then on to menopause and pelvic floor. So a lot of women experience changes to the pelvic floor function during perimenopause, and they may start to experience leaking when they haven't before. So maybe they've been pregnant, maybe they've given birth, and there's not been an issue at all, or they haven't been pregnant, they haven't been given birth, and they've never had this issue before, and then it starts happening. And this is because the connective tissue, such as tendons and ligaments, love estrogen. So if you go back to that first image I showed, and I'll show you with the my model here. So all this blue, all the white in the image, all this blue is connective tissue, and it's what's attaching the pelvic floor to the bones. Once we have a decline in estrogen, those tendons become less elastic, they become less hydrated, and they become less supportive. So any issues that may have been there in the past, and that were kind of there but not there because the pelvic floor was working okay, once you have those weaknesses in the tendons and connective tissues, that can cause a problem. It's also why a lot of women during perimenopause and menopause get things like plantar fasciitis, frozen shoulders, joint pains. It's all to do with the connective tissues and the fascia really wanting a lot of estrogen, and the estrogen not being there. So thinking about what can help with this. So this is not just for the pelvic floor, it's also for general joints and fascia and connective tissue well-being. So mobility work to help keep the joints lubricated, to keep the connective tissue hydrated, working on stability with balance work and single leg movements to help you keep you stable. So that's a sort of more of a joint thing than a pelvic floor thing. Warm up and cool down. Warm up with walking and dynamic movements to get the blood flowing and the joints lubricated. So it may be that if a woman in her 40s and 50s or late 30s is starting to find it really hard to run, everything just feels really achy, she may need a longer warm up and a longer cool down, just to help with that, just to get everything lubricated. And then thinking about nutrition and hydration. So as I said, the estrogen keeps that connective tissue hydrated. Optimal water intake will help to keep the joints and connective tissue hydrated. So drinking enough water is really important. But if you have a pelvic floor issue and you're leaking, a lot of women will not drink. So it might be that they know they're going on a long run, they know there won't be any toilets, so they don't drink enough. And that dehydration can cause bladder irritation, which can then exacerbate any of those pelvic floor symptoms. It can mean that you're leaking more. So nutrition and hydration becomes really key at this stage, making sure you're hydrated, even if you're leaking, because overall it's really going to help by it. But I completely understand that so many women will keep themselves dehydrated because of fear of leaking. So yeah, just making sure that anyone that you're coaching, or if you're experiencing leaking, that you are keeping hydrated. So that kind of gives a little bit of an overview. So hopefully that's given you a good overview of yeah, what the pelvic floor is, and all the different changes that can happen. Now I want to go on to pelvic floor and running. So with the pelvic floor issues and running, it's not always the pelvic floor that is the main problem. There can be a lot of things that aren't necessarily pelvic floor related. So if you think of the pelvis, there's a lot of other muscles attaching itself to the pelvis, going through the pelvis. So things like your hip flexors, the glutes, the piriformis, there's so many different muscles that are here that we use in running that can cause pelvic floor issues. So if you have a runner, or if you run and you leak, I would ask this question, or these questions, and that is, when do you leak? So is it when you're running uphill? Is it when you're running downhill? Is it when you change pace? Is it when you're changing direction during speed work or on longer runs? So this can all give you clues of what else might be happening as well. So it might be that, yes, you do need to do some work on your pelvic floor, but actually other things are happening. So asking these questions, finding out when do you leak, is really key, because then you can do something about it and you can try and help. So what can help? Technique. So thinking about uphill, are they leaking because they're taking bigger strides? When they're going downhill, is there a lot of impact because you're sort of putting your brakes on as you're going downhill? As you're changing from slower to faster running, is there something that's changing that's meaning yeah, that's then going to be affecting the pelvic floor? So there's lots of things as a running coach that you can look at to help with pelvic floor that isn't necessarily pelvic floor, and a lot of that's to do with things that you'd be doing anyway, but it's just to kind of notice that if somebody's saying, oh, yeah, I really leak when I go uphill, so I don't really want to do this uphill with this race, that's really hilly race, and because I leak with that, and then think, oh, okay, so you're leaking when you're running uphill, you're leaking when you're running down. Let's look at the technique and see if there's anything that we can do to improve your technique, which will then hopefully also improve the pelvic floor. Things like glute strength. So if the glutes aren't strong enough, the pelvic floor and other muscles might kind of start taking on a bit of that work that the glutes should be doing. The same with core strength, making sure that the core is really nice and strong and stable, so that you can stay upright in that nice tall running position rather than sort of sinking down and tilting the pelvis. Making sure the hip flexors and all around the hips are nice and flexible. But then also talking about ankle flexibility and taking care of your feet and rolling out your feet and looking after your plantar fascia, and yeah, all those kind of things as well will also help the pelvic floor, because it will mean that the ankle will be nice and flexible, and that's going to mean that everything else is going to be good as well. So it's not just thinking about what's around the pelvic floor or what's around the hip, thinking a bit above and a bit below, just as if we would with anything else. So, you know, if somebody's got a knee issue, you don't necessarily just look at the knee, you're looking at the ankles, you're looking at the hips, and you're looking at what's going on about around there. So has anybody got any questions about that? I'm almost finished. I can ask at the end. I think we're all good. We'll ask at the end then. Okay, so what next? So the main thing about this is to have that conversation, and to if somebody kind of comes to you and says, oh, I'd really like to do that race, but they don't have any toilets on the race, and I only do races where there's toilets, then that kind of gives you a thought like, they probably have some issues with their pelvic floor. Maybe we can have that conversation, and then we can try and do something about it. Or if somebody, you know, if you're noticing that even in the height of summer, somebody always has a a long sleeve top tied around their waist. I've had a few runners like that, and that's usually because they're a bit worried about leaking and just want to make sure that everything's covered up. So if you notice anything like that, it's just about having that conversation, and then making sure that it's not just a conversation, that your runner knows that there's something that can be done about it. So the pelvic floor is a muscle. It's like any other muscle in the body. We can train it just like we train our quads, just like we train our biceps. We can do something about it. It's not an inevitable part of having children that you're going to have a weaker pelvic floor, or it's not an inevitable part of getting older. You know, things do change, but we can do something about it. So people who can help would be, first off, kind of thinking maybe you want to talk to your GP about it. Depending where you live, that may or may not be a good option. So I'm in Buckinghamshire, and I know that in Milton Keynes there's a hospital there that actually has a self-referral women's health physios that you can refer yourself to, and that's part of the NHS. The GPs might be able to refer you as well. There's quite often a long waiting list, so unfortunately, although the GPs hopefully would be able to help, they can't always, or it can take quite a long time. So the other way you can do is to go private and look at women's health physios. So women's health physios or pelvic floor physios, there's quite a lot of people who specialize in that, and they are like will really help you. If you're not sure where to look for a physio, then I would suggest the Mummy MOT website. That is a specific service, that is a postnatal service where they kind of do a check of the pelvic floor and check everything. But if you look on there, search for your area, you'll come up with a physio in your area. So that's a good place to go. And then, of course, holistic core restore coaches like myself, we can help. We kind of look at pelvic floor, not just as the pelvic floor, but holistically. So we're looking at the core, the breathing, the movement, how you move, and also stress as well. So yeah, so those are the kind of people that I would suggest that you refer your runners to. But it's really about having that conversation and knowing that it's something that's common, but it's not something that you have to put up with. You can do something about it. For a lot of women, pelvic floor issues can start to become a barrier to them doing the races they want to do, doing the running they want to do doing the activities they want to do. And we kind of want to make sure that everybody can run for as long as they want to. So yeah, you can definitely do something about it. And then, of course, I'm really, really happy to talk to anybody. I always say there's absolutely no obligation to work with me at all. I'm happy to chat with fellow coaches. I'm happy to chat with fellow runners, just to kind of, yeah, be someone that you know that is happy to chat. So yeah, so I'll stop there. If there's any questions, please ask. Please unmute yourself and ask.
So, hi. So that was really interesting. Thank you. A question I've got, which I don't think we covered, was are there any exercises or workouts that could actually exacerbate or make these things worse?
Yeah, so high impact work and exercises can, and I think being aware of your breathing as well. So if you're doing an exercise, if you're squatting or lunging, a lot of people will hold, especially if they're lifting heavy, will hold their breath to assist with that, and that can put a lot of pressure on the pelvic floor. So what I would encourage is to breathe out on the exertion. So if you're lifting something up, you breathe out as you lift up, just to decrease the pressure on the pelvic floor. Sometimes movements that have a sort of a lateral movement, like lateral lunges or anything that's kind of that side to side movement, can exacerbate it. And if that is the case, then working a bit on that hip stability, working a bit on the hip flexibility would be really good. So it's always kind of, there are, I think, exercises that may need modification, but I would never say something's completely off the table unless it is really, you know, really you're feeling it a lot. And I think if you've got a lot of if something makes you leak a lot, then it's probably not something you should do right now. So it might be that you can come back to it after you've done a bit more work on improving your pelvic floor. Yeah. So yeah, it's kind of one of those things where it's like, I don't want to say no, that this is definitely no, because it really does depend. But I think high impact, like running, yeah, does sometimes exacerbate it. And so if you're thinking about runners sprinting, and when I said about the changing of speed as well, that can be something that can impact it, because you might be kind of landing a bit harder as you run faster, possibly.
Okay, thank you.
Has anybody else got any other questions? No, all good.
All right. Well, look, if anyone has any questions, just jump in. But Nick, thank you ever so much for
That's
that.
okay.
That was really interesting. Going to share this around the Run Leads community, and we'll make the video available to vegan runners more generally.
Yeah,
So amazing stuff. And if anyone has any questions, either they can reach out direct to yourself
yeah,
or email me on on the training secretary uh, email address for the vegan runners. Um, and we'll get those questions answered, I guess.
lovely. Yeah, yeah. Any questions at all? Even if, you're watching this and you think of something a couple of days' time, just ask, and I will do my best to answer.
Amazing, amazing. All right, well, thank you. I really appreciate it. And yeah, we'll catch up soon.
Excellent. All right then. Oh, that's okay. Bye bye.